Hello friends, my name is Deepak Mishra and through this video I have tried to summarize the procedure of getting into post-graduation training in Germany. So if you are a beginner and if you're contemplating about getting onto the path of post-graduation in Germany and you don't know how the process is and how you should start and where does it end and what is the middle process, I have brought up a presentation for you. I shall be explaining it shortly. So keep watching. Thank you. So, friends, by now you might have found out that the procedure about the medical postgraduate training in Germany is diffuse and also tedious. The information is not very clear. The information is all overall in German, and people who do not understand it find it very difficult to make sense of it. And when you use translator, then things go out of context, and then you don't have any idea of how what is going on. So in this video, I have tried to summarize the steps in a sequence as a flow chart, and but this presentation is not inclusive of all the procedures. There are some steps and some procedures which are not in all the states. They are not standard. They are followed only in some states or in some places, and I have not covered them in this video, but then I shall be covering them in another videos. I'll cover the standard uh, procedure for the post graduation here, and here we go for the next steps. Step number one is learning the German language. So the German language is divided into six parts: A1, A2, B1, B2, C1, C2. B2 is mandatory by law and C1 is preferred. So if you want to work as a doctor in Germany, you need to at least have a B2 level of German language. The duration from A1 to B2 is around 6 to 10 months, and you can do it you can do this course from Goethe Institute, that is a standard institute all over the world imparting German language education to interested candidates. And you can also do this if you do not live in a place where you have Goethe Institute, or you do not have time, or you are a working professional. Then you can also do this course at some private institute, or maybe through Skype, or maybe some online program, or maybe yourself. At least a couple of initial steps, levels A1, A2 can be done on your own as well. You can do them, and you can take the Goethe the exam for these levels from Goethe Institute as an external candidate. So at the end, what matters is also, I mean, definitely you need to know the language because you have to work, but then certificate matters the most. Going to step number two is, what do you do after passing B2 level? There are three steps. These are the basic steps. These steps can also be combined. For example, step number one is you can either apply for a job seeker visa at a German embassy and you get a 6 months visa and you come here and try to find a job. Or you can apply for hospitations, that is observerships at German hospitals through emails from your place in India or wherever you are right now. Or or you can take admission in some medical German course in Germany and get a student visa and come into Germany and do your further procedure. And these levels can also be mixed, as you can apply for a job seeker visa, get a job seeker visa, and you come here and also join a medical German course. So you can come for a hospitation and also do a medical German course. So these things can be combined as well. The next step is, after arriving in Germany, you start applying to hospitals through emails and post. And this time you are applying not for hospitation, but you are applying for a stellar. You are applying for a job placement as an assistant arts, as a resident. And you keep applying to all the hospitals in your departments of interest till you get a positive response. And once you get a positive response, you prepare for interview seriously and attend the interview and ace the interview to get the job. Because remember, there are many people applying for the same job, and like nowadays hospitals have choice to choose a better candidate because there are a lot of applicants these days. So you have to be good, you have to be convincing, you have to have a good language so that you will be selected for the job. Step number four is, after you get selected for the job, you get an appointment letter, that is an Einstellungszusage. That is a promissory letter that states that you will be appointed as a doctor once you have a medical license. Because right now you do not have a medical license, you are not a doctor in Germany. With this appointment letter, with this Einstellungszusage, you apply to the Erste Kammer, that is a medical council, for a Berufserlaubnis, that is a medical license, temporary medical license. Once you apply to the Berufserlaubnis, erste Kammer invites you for a Fachsprachprufung. Fachsprachprufung is a medical German exam. They take your exam and then they decide that if your medical German is good or not. If it's not good, then you have to take the exam again, and if it is good, then the process goes ahead. They'll send you documents for verification from a university and to the consulate in India or your native country, and then during this entire process that takes around 3 to 6 months depending upon which state you are working in Germany or applied in Germany, or from, and also from the country where you have done your MBBS from. So in this time, you keep doing your hospitation further, and in this hospitation, you gain insight about working in a German hospital, and you get used to things. You get to know what to do when, because after you get your Berufserlaubnis, that is a medical license, you will be working as a full registered doctor. Then you will be responsible, and then if you don't understand the language or if you have difficulty in knowing the process of how things are done here, then you will be in trouble. That's why it's important to do it. I mean, hospitation helps so that uh, you get an insight, a perspective of the system. The next step is after Berufserlaubnis, you go to the hospital and get your work contract. And now this is a binding work contract, proper contract. And with this contract, you go to the Ausländerbehörde, that is the Department of Foreign Affairs. It's a government office, and there you apply for a blue card, that's a residence permit. Because till now you have been here on a, say, tourist visa or a visitor's or a job seeker visa or a student visa. So you are not allowed to work, you are not allowed to earn salary. Now with this visa, now this blue card, you will be allowed to earn salary. So you apply for that, and then that is also your Arbeitserlaubnis. Arbeitserlaubnis is working permit. That is also the same. And after that, things are simple. You start working as an assistant arts, that is a resident doctor, and you wait for your first salary of around 2,300 euros at end of the month, and then you keep working further and learning further. Thank you very much for watching. Please like, share, and subscribe to the channel, and keep watching channel further. Thank you very much.